One of the things we know about autism, for example, is that in the developmental process, most parents figure out that there's something developmentally wrong with their child, on average, by the time the child is 19 or 20 months. That's long before, by the way, most pediatricians and family practitioners figure it out. And in fact, we need to know that parents who have concerns about their child in the second year of life, that just have a funny feeling that development isn't going well, we need to take that exquisitely seriously, because more often than not, the parents are right. More often than not. Now, sometimes they're wrong, but you're never wrong as a parent to be too cautious. And it's our job then to make the assessments and figure out whether they are cautious, whether their caution is justified. So there are things that are probably reasonably good to think about. A child who's not speaking by the age of 15 or 16 months bears some careful attention. They're at increased risk. Now, is it possible that child will start speaking at 19 months or 21 months and do just fine? But of course. On the other hand, if they don't, what we've done is missed an opportunity for an early intervention. Is a child who's not walking at the age of 14 months or 15 months, a boy at 13 months, does that mean that they'll never walk and never run and never play professional sports? God forbid. The answer to that is we don't know, but a boy who's not walking by 13 months, we've got to be worried about. And there are other risk factors that we need to be worried about as well. So children who are not terribly social or socially responsive, who gaze avert very early on, are not easy to soothe very early on, and I'm talking about all in the first year of life, we know those children are at increased risk for having problems. And knowing that happened in the first few months of life, or if you're seeing a child that young, really raises some level of suspicion. If not for the fact that the child may have later developmental problems, then for the fact that these children are particularly difficult to parent, and it has an impact on the way the parent feels about the process of taking care of the child.